7 simple steps to lower your risk and even reverse heart disease. Heart disease is America's and most other countries' #1 killer. It attacks both genders, and most Americans are at risk of it, especially if they continue consuming the typical American diet and lifestyle. Heart disease is a condition in which your arteries narrow to the point where your blood supply to the heart is cut off, keeping precious nutrients and oxygen out of circulation. This happens whenever plaques or fatty deposits rich in cholesterol are built up inside the arterial walls, narrowing them down over time. This particular condition is called atherosclerosis. You don't want that plaque to build up to the point of no return, because this will result in arterial spasms that impede your heart's function. With that said, here are the methods you can follow in order to lower or even reverse your risk for heart disease. Method 1. Avoid smoking. Smoking is one of the major risk factors out there when it comes to heart disease. That's right, on top of increasing your risk for lung cancer and other respiratory illnesses, it can also contribute to your risk for heart attack and other possible cardiovascular conditions. If you're nearing or past 40 years of age, it's imperative that you prevent your heart from withering away due to plaque buildup in your arterial regions by resisting the urge to smoke or quitting while you still have your good health. Your risk for heart disease will typically go down as soon as you stop smoking. Besides which, on top of preventing heart disease, you'll also reduce your risks for developing common respiratory ailments like emphysema and tuberculosis to boot. Method number 2. Lowering cholesterol consumption. Plaque buildup in your arterial walls is mostly caused due to eating fatty food and not exercising enough to burn off that fat buildup. High blood cholesterol is the kind of situation that increases your risk for coronary heart disease development by leaps and bounds, because excess cholesterol tends to build up in your arteries' inner walls on top of accumulating all over your body. As long as you continue to have a sedentary lifestyle and whatnot, you'll boost your chances of narrowing your arteries and letting less blood pass through your heart, which will then lead to a heart attack and various other heart conditions. Your total blood cholesterol should be below 200 milligrams per deciliter if you want to stay as healthy and fit as possible. Method number 3. Avoid becoming obese or overweight. Your risk for heart ailments will be significantly reduced if you were to stop living a sedentary lifestyle and keep yourself from becoming obese. If you're already obese or overweight, then it's about time that you changed your lifestyle, reduced your sugar intake, and started exercising. American obesity is becoming quite the prevalent and widespread ailment, such that it is no wonder that heart attacks and other cardiovascular conditions serve as the primary causes of death in the United States in the past decade. More to the point, about 34 million adults, 1/3 of them, are classified as obese. Furthermore, 60% of the population in the U.S. isn't getting the exercise and physical activity they need. Cardiovascular disease's most important risk factor is obesity, particularly abdominal adiposity. Method number 4. Regular exercise. If you really want to avoid getting heart attacks, then it's imperative that you exercise. Even brisk walking or any moderate intensity activity can substantially reduce your risk for cardiovascular disease. There are quite a lot of findings to support this claim, such as the 1995 Federal Exercise Guidelines that endorse moderately intense physical activity for the majority of days in the week, because you also need a few days to rest in order for your body to relax and repair itself. Aside from heart condition risk reduction, the relatively safe program can even reduce your risk for insulin resistance and non-insulin dependent diabetes mellitus, which in itself is a risk factor for cardiovascular disease. Diabetes can increase heart disease risk 3 times to 7 times in women and 2 times to 3 times among men. Method number 5. Eat a balanced, fat-free meal with more fiber. By eating less saturated fat and consuming more fiber, you'll be able to lose weight or maintain your ideal weight, which should then in turn reduce your risk for cardiovascular maladies. In fact, the Annals of Internal Medicine publication has recently confirmed that consumption of fruits and vegetables, specifically the green leafy vegetables and vitamin C-enriched fruits, appears to have a positive effect against your risk for coronary heart ailments. Diet is even capable of reversing coronary artery disease altogether if it's combined with positive lifestyle changes. For example, don't lead a sedentary life and instead exercise more. You should consider having a vegan diet, Mediterranean olive oil-based diet, or even a flexitarian one if you really want to significantly decrease your chances for heart attack. Number 6. Consume less alcohol or don't consume any at all. The doctor's recommendation to drink alcohol moderately is not only a good commercial byline, but is also great advice when it comes to reducing your heart condition risk. If you want to significantly reduce your chances for cardiovascular disease, then it's imperative that you moderately drink alcohol as much as possible. And again, drinking alcohol at all can increase your risk for breast cancer if you're a woman, and raise your blood pressure if you're either gender. Moderation in most cases is the best way to deal with sickness, because it's usually having too much or too little of something is where the problems start cropping up. Then again, if you can help it, it's better not to drink at all, if only for the sake of your liver as well as your heart. Method number 7. Consume cardiovascular disease risk-reducing vitamins and minerals. If you want to reduce your risk for cardiovascular disease, then you should consume or supplement your diet with antioxidant vitamins, specifically homocysteine-lowering agents such as B6 and folate, as well as good old vitamin E. These substances have significant roles when it comes to lowering your chances for cardiovascular condition development. Randomized clinical trials have so far been promising in regards to the effectiveness of these nutrients in heart attack risk reduction. To the point, having high homocysteine levels is almost as deadly as having high cholesterol levels when it comes to cardiovascular health.